So here is my presentation. Uh, First of all, COVID-19. So what is coronavirus? The coronavirus is a new respiratory illness first identified during an investigation into an outbreak in Wuhan, China, but has now spread to other parts of the world. The virus that causes COVID-19 is called SARS-CoV-2 and is spread between people who are in close contact with each other within about 6 feet, mostly through respiratory droplets produced when an infected person coughs or sneezes. People are thought to be most contagious when they are sickest. However, growing evidence suggests that COVID-19 may be spread by people before they start showing symptoms. So, why it is called coronavirus? Coronavirus are named for their appearance. Corona means crown. The virus outer layers are covered with spike proteins that surround the them like a crown. You can see in the picture. So, uh, how does the coronavirus spread? As of now, researchers know that the coronavirus is spread through droplets and virus particles released into the air when an infected person breathes, talks, laughs, coughs, sings, or sneezes. Larger droplets may fall to the ground in a few seconds, but tiny infectious particles can linger in the air and accumulate in indoor places, especially when where many people are gathered and there is poor ventilations. This is why mask wearing, hand hygiene, and physical distancing are essential to preventing COVID-19. So you can see in the pictures the droplets are coming outside and it is spreading COVID-19. So next page. How did the coronavirus start? The first case of COVID-19 was reported on December 1, 2009, and the cause was a then new coronavirus, later named SARS-CoV-2. SARS-CoV-2 may have originated in an animal and since mutated so it could cause illness in humans. In the past, several infectious diseases outbreaks have been traced to various viruses originating in birds, pigs, bats, and other animals that mutated to become dangerous to humans. Research continues, and more study may reveal how and why the coronavirus evolved to cause pandemic disease. What is the incubation period of COVID-19? Symptoms show up in the people within 2 to 14 days of exposure to the virus. A person infected with the coronavirus is contagious to others for up to 2 days before symptoms appear, and they remain contagious to others for 10 to 20 days, depending upon their immune system and the severity of their illness. What are the symptoms of coronavirus? COVID-19 symptoms include cough, fever or chills, shortness of breath or difficulty breathing, muscle or body ache, sore throat, loss of taste or smell, diarrhea, headache, fatigue, nausea or vomiting, runny nose. Some people infected with coronavirus have mild COVID-19 illness and others have no symptoms at all. In some cases, however, COVID-19 can lead to respiratory failure, lasting long and heart muscle damage, nervous system problems, kidney failure, or death. If you have a fever or any of the symptoms listed above, call your doctor or a healthcare provider and explain your symptoms over the phone before going to the doctor's office. Urgent care facility of emergency room. Here are suggestions if you COVID-19 means the prevention is coming. How is COVID-19 diagnosed? COVID-19 is diagnosed through a laboratory test. Diagnosis by examination alone difficult since many difficult since many COVID-19 signs and symptoms can be caused by other illness. Some people with the coronavirus do not have symptoms at all. How is COVID-19 treated? Treatment for COVID-19 addresses the signs and symptoms of the infections and supports people with more soft diseases. For mild cases of coronavirus, disease, your doctor may recommend measures such as fever reducers or over-the-counter medications. Most of cases may require hospital care where a patient may receive a combination of treatments that could include oxygen, mechanical breathing support, and other COVID-19 treatments in development. Infusions of monoclonal antibodies given to certain patients early in the infection may reduce their symptoms, severity, and duration of their illness. So, who is at higher risk of coronavirus? Anyone, no matter their age, can become sick with COVID-19. However, older adults over 65 years of age and people with compromised immune systems or chronic conditions such as diabetes and lung disease may be at higher risk for developing more serious symptoms or complications from COVID-19. To prevent the spread of COVID-19, maintain a safe distance from others, at least 1 meter, even if they don't appear to be sick. Wear a mask in public, especially indoors or when physical distancing is not possible. Choose open, well ventilated spaces over closed ones. Open a window if indoors. Clean your hands often. Use soap and water or an alcohol based hand rub or hand sanitizer. Get vaccinated when it's your turn. Follow local guidance and about vaccinations. Cover your nose and mouth with your bent elbow or a tissue when you cough or sneeze. Stay home if you feel unwell. So the next page, types of COVID-19 vaccines. What are the COVID-19 vaccines currently available? Currently, there are three COVID-19 vaccines that have received authorization from for emergency use, and one that has been fully approved by the U.S. Federal Food and Drug Administration. These are the Pfizer BioNTech COVID-19 vaccine, fully approved on August 23rd, 2021. This vaccine is often referred to as the Pfizer COVID-19 vaccine. The Moderna COVID-19 vaccine, approved for emergency use on December 18, 2020. The Johnson and Johnson COVID-19 vaccine, approved for emergency use on February 27, 2021. How do the COVID-19 vaccine works? The COVID-19 vaccines are a type of medicine that work by teaching our body how to recognize and fight the virus that causes COVID-19. The COVID-19 vaccines will help protect us from getting COVID-19, becoming very sick with the virus, needing to be hospitalized, or dying from COVID-19. So vaccination is important. Why is it important to get a COVID-19 vaccine? Getting vaccinated is a powerful tool that will help save lives and end the pandemic sooner. When more of us are vaccinated, the more we protect ourselves and our loved ones against COVID-19 and other variants. What are COVID-19 vaccines made of? The Pfizer and the Moderna COVID-19 vaccines use messenger RNA, also called mRNA. mRNA COVID-19 vaccines teach our body to recognize and fight the virus that causes COVID-19, protecting us from getting sick altogether or getting too sick. The Johnson and Johnson COVID-19 vaccine does not use messenger RNA. Instead, it uses a viral vector to create a strong immune response in our body that will recognize and fight the virus that causes COVID-19. Like messenger RNA vaccine, the viral vector in the Johnson and Johnson COVID-19 vaccine does not interact or change our DNA. What is COVID-19 vaccine booster? So, a vaccine booster is an additional vaccine given after the original vaccine dose to maintain the same level of immunity for a longer period of time. Who is eligible to get a COVID-19 vaccine booster? Currently, only certain population who received both doses of their Pfizer COVID-19 vaccine at least 6 months ago are eligible for a COVID-19 booster shot. Adults 65 years and older, adults 18 years and older who have underlying medical conditions like cancer, kidney disease, respiratory illness, diabetes, HIV, etc., and liver disease are eligible to get COVID-19 vaccine. Adults 18 years and older who work in the high-risk settings like first responders, education staff, food and agricultural workers, manufacturing workers, correction workers, U.S. Postal Service workers, public transit workers, are eligible for getting vaccine boosters. Adults 18 years and older who live in high risk settings such as long term and healthcare facilities, schools, correctional facilities, homeless and shelters, they are eligible for getting COVID-19 boosters. What are the common side effects of COVID-19 vaccines? The common side effects of among adults, teens, and children eligible for the COVID-19 vaccine include pain, redness, and swelling in the arm where you got the vaccine, fatigue or tiredness, headache, muscle ache, chills, fever, nausea. It is normal for these side effects to last for a few days after receiving either of the COVID-19 vaccine. These side effects mean that the vaccine is working. Some people might not present any side effects, which is normal as well. The COVID-19 vaccine is still building the immunity we need to recognize and fight COVID-19 even if you don't show the side effect. For the Pfizer and the Moderna vaccine that require a second dose, some people may feel side effects for a few days after either or both these vaccines. So the last page, why should you what should what you should do to prevent COVID-19? Maintain a distance of at least 2 meters from each others. Regularly wash your hands with soap and running water or use an alcohol-based hand sanitizer. Cover your mouth and nose with a tissue, handkerchief, or bend elbow when coughing and sneezing. Wear a mask while in public places. Avoid touching your nose and mouth. Avoid handshaking and hugging. Avoid contact with anyone with flu-like symptoms, fever, coughs, etc. Thank you.